All right, well, let's go ahead and get started. Today, we are going to unlock the secrets of ABGs. So I'm curious to hear from you guys, where are you joining from? And you're going to let me know by joining me on Slido. How you do this is you're going to take your phone, you're going to scan that QR code, and it's going to join you into the event. Or you can even just let me know in the comments. Amazing. Give you guys Houston, Alberta. Awesome. Amazing. Minneapolis, Germany, New York, Toronto. Vancouver, Milwaukee, Columbia, Colorado. Awesome. So cool. The Philippines. That is great. New Jersey, Toronto. Awesome, awesome. My favorite thing about doing this and why I love to start with this is it's just so cool to me to see how we can have a connection of nursing, but we're from all over the world, not just in the States, but from all over the world. Turkey, the United Kingdom, amazing. So I'm curious to hear, how do you feel about ABGs? Are you like, do not test me on ABGs? Or are you like, okay, I've got these ABGs down? Okay, we've got a few experts with the fours and fives. The ones and threes, maybe not as much. How about with compensation? How about if I were to ask you to tell me if it's compensated, uncompensated, or partially compensated? Yeah, that can make it a little bit more tricky for sure. All right. Yeah, that's where we're getting more of those threes. It kind of shifted our graph there just a little bit. Well, my goal today is to help you feel more confident in ABGs and how you apply your knowledge to these ABG items. So let's get started with the basics. So the first thing that I really want you to understand is, what is pH? Well, our body is very specific. It likes our pH to be between 7.35 and 7.45. Now, about if it goes outside that normal range, that is when the body is like, okay, I need to use the buffer system to bring that pH back into normal range. That's called compensation. Now, a key thing I need you to understand is the pH doesn't just move itself. The pH doesn't just say, oh, today I'm going to be 7.28, tomorrow I'm going to be 7.51, right? It doesn't just move itself. Something has to make it move. And that's either going to be bicarbonate, which is produced by the kidneys, or it's going to be CO2, which is produced by our lungs and is part of the respiratory system. So when we look at our kidneys, when we look at our metabolic system, it makes HCO3, and that is a base. So it is going to raise that pH the more base we have. The less base we have, it will lower the pH. Now, knowing that bicarb is made from the kidneys, what do you think would cause an impact on our bicarbonate levels? What do you think? What would cause an impact here? Any injury to the kidney. Absolutely. If we cause impact on the kidney, then we can have kidney issues. You have got it. Now, okay, let's take a look at our respiratory system. Our respiratory system is going to breathe out CO2, and CO2 is an acid. So the more someone holds on to CO2 in the body, the more acidotic they are getting. The more someone breathes off CO2, okay, the more alkalotic they're going to get. Okay, so the more CO2 that's held on to, the more likely they're going to become acidotic. Now, what would cause us to hold on to CO2? Drop it in the chat. What are some things that you're like, ooh, that would cause a CO2 change? Let me know. What are we thinking? COPD, absolutely. What else? Hypoventilation, trauma to the head. If we depress the central nervous system, maybe they overdosed, right, on opioids, and now their central nervous system is decreased and their breathing rate went down. Yeah, sometimes our ventilator settings, maybe they've had some type of a pneumothorax and they collapsed lung. Absolutely. What about what would cause us to increase the amount of CO2 we're exhaling? That's where anxiety comes in. If someone's in a panic attack, right, that's going to cause them to breathe off more CO2. The thing I want you to really understand is that with this, one of these is more effective and one of these is going to be faster. So which one's more effective? Our kidneys or our lungs? Which is going to be more effective at bringing back that pH into normal range? The one that's more effective is going to be our kidneys. But which one's faster? Which one's faster here? Yeah, absolutely. The lungs are a lot faster. So the kidneys are going to work better, but our lungs are going to be faster at responding. So here's the normal ranges I want you to know. pH 7.35, bicarb 22 to 28, and our CO2 is 35 to 45. Now, I know that you're probably thinking, Rachel, why in the world does this bicarb say 22 to 28? I learned 22 to 26, or I learned this range. Guys, everywhere I've worked has had a different range. The benefit here is that the NCLEX, right, they are going to give you your normal ranges that they want you to use. So if you're in Canada, they're going to give you the normal ranges for your NCLEX. You don't have to worry about memorizing those normal ranges. What you do have to understand is, what do I do when the number is really high or when the number is low? What are going to be my interventions as the nurse? So there are 3 steps that we go through to be successful with ABG questions. The first is always asking ourselves, is it acidotic or is it alkalotic? We're really thinking of like, okay, which way is the party going? Then we have to ask ourselves, who caused the party to go that way? Who's the troublemaker at this party? And that troublemaker is going to be what pulled the pH with it to cause it to go into either that acidotic or into that alkalotic range. And then the third and final step, and the step I usually see students get the most stuck on, is really looking at, is it compensated? Is it partially compensated, or is it uncompensated? So let's take a look at just the first step. So I am going to give you a number here. What if I said that the pH was 7.42? Actually, let's do a different one. 7.23. 7.23. Do you think our client is going to be more acidotic or are they going to be more alkalotic at 7.23? So at 7.23, they're going to be over here, right? So I would say they're going to be acidotic. Now, what if I said that their pH was 7.62? Well, then I know they're going to be alkalotic, right? So it's really easy because I can just follow that pH specifically. So now we're going to go to step 2. Is it respiratory or is it metabolic? I have to know who is the troublemaker here, who caused my pH to go outside of the normal range. Now, we already talked a lot about this. What would cause us to have a respiratory acidosis? Well, too much CO2. Well, why would we retain too much CO2? It could be that our client's hypoventilating. It might be that they overdosed on opioids or they've got COPD or asthma, right? They're retaining CO2. They're not able to get that CO2 out. Now, Alkalosis, what would cause us to breathe off too much? A panic attack. We're hyperventilating. When we breathe off like that, if you do it and you don't need to, right, you might feel a little dizzy, like I do a little bit from doing that. What happens is we breathe off too much CO2, we're losing too much acid. Now, on the opposite side, we've got our kidneys. What causes an acidosis is when we have damage to the kidneys, or we lose bicarb. And one of the ways that the body loses bicarb is when they have diarrhea. Bicarb is kind of stored and reabsorbed at the end of the GI tract. So if somebody's having diarrhea, they're not reabsorbing that bicarb that they need. And what then happens is they are going to, right, lose the bicarb and they're going to become acidotic. What's an example of a disease process you can think of? Think of a diabetic, hint, hint, that causes a metabolic acidosis. What is a disease process that leads to a metabolic acidosis? DKA, diabetic ketoacidosis. Well, why does it cause this? Well, because what happens here is the body starts to break down fats. And when the body breaks down fats, it produces what is called ketones. Ketones are an acid. And so we want to understand the patho because then it makes sense. Oh, yeah, this makes sense why diabetic ketoacidosis is a metabolic acidosis. And then we've got our metabolic alkalosis. And this is when we would have too much bicarb or not enough acid in the body. This can happen if we as healthcare professionals end up giving too much sodium bicarb to our client, or if we get rid of acid. And that happens with antacids, with vomiting. Maybe the client's hooked up to an NG tube. Now, let's go through, let's do an example together. What if my pH was 7.23? So we're going to do this together, 7.23. And my CO2 was 62, okay? And my bicarb is 22. Where are my X's lined up? Where do you see two X's that are lined up together? Is this respiratory or is this metabolic? Good. It's respiratory. We see that our two X's are lined up on the respiratory side. Now, anyone notice how the CO2 is written backward? Anybody see this or notice this? Did I do that intentional or did I mess up? Did I make a mistake? What do you guys think? Was this an intentional that I wrote it backward? It's intentional. Why? Because the more CO2 we have, the more acidotic our client gets. All right, let's do another example. Did doing an example like that help, or did that make it more confusing? I'm teaching this a little different than how I've taught it in the past. Helpful. All right, let's do another one just like that. So now our pH is going to be 7.62. Put it over here. And our CO2 is going to be 49. So that's kind of over here. And our HCO3 is going to be 31. Now, just to give you a little hint, something I do, if my X falls within inside the brackets, I put it inside the brackets. If it's outside, then I put it way over to the side. Because for me, visually, it's a lot easier to see it when I do it that way. So now I want you to tell me, where are your X's on the same side? Is it a metabolic issue or is this a respiratory issue? Yeah, this is a metabolic issue. So because this is a metabolic issue, then we would call this a metabolic alkalosis. Now, the third step that we would go into is this compensated or is this uncompensated? Now, I'm going to give you some tips. Everyone ready to take a few notes because I've got a few really helpful tips to give you. The first is, if all three values are normal, guess what we call it? Normal. So write that down. All three normal equals normal. There's nothing to figure out. But if your pH is normal and one or both, okay, if one or both of your other values are abnormal, well, then it's going to be fully compensated. The only time you can put fully compensated is if your pH is normal and one or both of the other values are abnormal. If your pH is not normal, you cannot say that it is fully compensated. Now, partially, I think is the easiest to identify. The reason why, all three will be abnormal. Three are going to be abnormal here. What this means is that, hey, the troublemaker, it pulled the pH outside of the normal range, and the buffer system said, hey, I don't like that. I want to pull the pH back into the normal range. It's recognized, the sidekick has recognized that there's a problem, but it has not yet been effective. And that's why it's partially compensated. It's partially at work. But then as soon as it gets that pH back into the normal range, that's when we call it fully compensated. It's just those other ones haven't resolved yet. So when all three are abnormal, that's partially compensated. And then lastly, if our pH is abnormal and just one other, so our pH plus one, okay, is abnormal, then it's uncompensated. What does this mean? Well, it means that if I am the troublemaker, I pull the pH with me into this abnormal range, and then there's the sidekick. It's got its feet up, it's being lazy. It's like, oh, I don't care that there's a problem. It's not doing anything to resolve the issue. So remind me again in the chat, are we talking about partial or fully? How do I tell the difference? Because they're so close. How would I know? What would I go back to if I'm trying to figure out partial or fully compensated? Let me know. Yeah, absolutely. I'm going to go back to the pH. Absolutely. Now, anyone new to Archer Review, can you drop a comment if you're like, I don't even know what Archer Review is. I'm just hanging out here today and learning about ABGs. Anyone new to Archer? Haven't heard of us before? Some of you are saying, hey, this is my first session. So if you're new to Archer and you're like, I don't even know where I'm supposed to get started, I don't even know what y'all do, right? We, okay, have our number one NCLEX product. It's called the SurePass combo. So if you want to have supportive and guided NCLEX prep, the SurePass combo is the one I recommend. This is what I recommend over just our QBank, hands down every time. And here's why. Our QBank is amazing, why it's included in this package, but also included in this package is Monday through Friday live lectures, our 3-day live NCLEX review, as well as all of our on-demand videos. My attitude for your NCLEX, guys, is if you're going to do it right. Do it to the best of your ability, because I only want you to have to take it once. I only want you to have to take it one more time, and that's it. And then we're done, right? And so my view always is, we're going to do it. Let's do it right. Let's give it all we've got, okay? So that's why I recommend the SurePass package. All of our packages are great. This is my favorite one. This is the one I always would bring students to. And we currently have a discount. Let me look what it is, because I don't remember it off the top of my head. I want to say it's Archer Cares, but I just want to double check myself here. If you go to buy this package right now, yes, we have 10% off with Archer Cares. So if you type in that coupon code or just click it, it'll add that 10% off. It'll save you some money. So if you've been on the fence, now's the time while that coupon code is out. All right, who's ready to do some practice? You guys didn't come here to hear me tell you about our packages. You came here to learn ABGs. Who's ready to do some ABG questions together? All right, I'm seeing let's go, and I agree. Let's go. All right, here is our question. The nurse is reviewing a client's ABG results. Which of the following, or which reveal the following? pH is 7.3, PaCO2 is 50, HCO3 is 24. The nurse is going to interpret these to indicate that the client has what? So our first step, is this 7.30? Is this acidotic or is this more alkalotic? So let's plug that onto our graph. What are we saying? Acidotic or alkalotic? Which way is this party going? Good. If you said acidosis, you got it right. Okay. Now, step 2, we're going to put these other numbers on the graph. So our CO2 is 50, our HCO3 is 24. So our CO2 was 50 and our HCO3 was 24. Where are my X's on the same side? Who is the troublemaker here? What do we think? Good. Absolutely. It's the respiratory system. Now, how do I know this? I know this because it lines up with my CO2. Now, let's move on to step 3. Is this compensated, partially compensated, or uncompensated? What do you guys think? Drop it in the chat. Good. Oh, I'm seeing some wrong answers. Are we partially? Are we on? Or are we fully? I would agree. I'm seeing some right answers. Remember, we do not say fully unless that pH is within normal range. It is not in normal range. Fully would be incorrect. So instead, we are going to call this uncompensated. It is an uncompensated respiratory acidosis. Does this make sense? Let me know if it doesn't. Does that make sense? All right, let's do some practice questions together. The nurse is assessing the client with the following arterial blood gas. What is the correct interpretation? I want you to try to do step 1, step 2, and step 3. Drop your answers in the chat. Anyone here still in nursing school? Raise your hand if you're, or leave a comment if you're still in nursing school. Okay, I'm seeing some yeses. Oh, Juliet just graduated on Friday. Congrats, congrats. Amazing. If you're still in nursing school, I have some things to show you at the end. Make sure you include that compensation step. I'm going to go ahead and graph these numbers out. 7.58, the CO2 is 35, the HCO3 is 41. Okay, first step, are we acidotic or are we alkalotic? Well, we see here that we are alkalotic. Now, who pulled me there? Because the pH can't just move itself. Someone had to put me there. And we see that my X's line up. My troublemaker is this HCO3. So I know that it's metabolic. I've got a metabolic alkalosis. My third and final step, is the sidekick helping? No, it's being lazy. It's still normal. So we would call this uncompensated. For this to be partially compensated, the CO2 would have to be greater than 45 for me to say partially compensated. So our answer here, let's do a drum roll here. Our answer is an uncompensated metabolic alkalosis. Does this make sense? Are you guys with me? You see where I'm coming from here? Okay, I've got yeses. We're going to go a couple minutes too long. Okay, here's our next question. Our pH is 7.2. Our CO2 is 70. Our HCO3 is 22. What are we going to call this one? I'm going to do this one a little bit quicker than the last. I want us to get a couple in yet. Good. Yes. I'm seeing lots of right answers on Zoom. Let me check out our other social platforms. Yes, I'm seeing some correct answers there as well. Amazing. Very good. Great job. You guys are getting it. Perfect, perfect. So let's go ahead. Let's talk about it. So number 1, which way is the party going? Well, we see we're in acidosis. So we've got that. Who was my troublemaker? Who pulled me over there? My CO2 did. This client right there. They're holding on to CO2 and it pulled that pH into acidosis. Now, is the sidekick helping? If the sidekick is within normal range, it means it's uncompensated. It means it is not helping. So would you call this uncompensated or partially? Let's do a curtain drop or a curtain roll on this one. What are we calling it? Good. An uncompensated respiratory acidosis. All right, I want you guys to try one that's not uncompensated. Ooh, the pH is 7.37. Little hint, if the pH is ever within normal range, draw a line down the middle for 7.4. So you know if it falls to the left or to the right. Our CO2 here is 80 and our H2O3 is 42. Ooh, this one's a trickier question. What do we think here for this one? This one's harder. Is this uncompensated, partial, fully? What do we think? What do we have here? Good. Let's take a look at this together. So our pH, we know we're in acidosis here. We need a different color. We know we're in acidosis here. Who was my troublemaker? Well, my X on the same side is with my CO2, which tells me that this is respiratory in nature. We've got a respiratory acidosis. Now, is the sidekick helping out? Well, we don't really care if the sidekick's helping out. It did because it was already successful because that pH is normal. If the pH is normal and at least one or both other values is abnormal, then we have what we call, a fully compensated respiratory acidosis, okay? It's fully compensated because that pH is within normal range. Are we good on that one? Did that make sense? Are we understanding here? Okay, awesome. I'm seeing yes. Here's the last one we have time for, and then I'll recap compensation for you all. All right, our pH is 7.52. And if you're struggling on the compensation step, listen in, because this is our kind of final example of what you would see with compensation. All right, what do we think the answer is to this question? Good. All right. Who's my troublemaker? Well, we see that our troublemaker is on the are we acidotic or alkalotic? We know we're alkalotic. Who's my troublemaker is where my X's are on the same side. I know that this is now respiratory alkalosis. So is the sidekick helping? And the answer is yes. How do I know this? Because the bicarb made itself go in the opposite direction. It recognized that there's a problem. The goal is that it'll bring the pH back into normal range. But has it yet been successful? No, it hasn't yet been successful. So because of that, we are going to say partially compensated respiratory alkalosis. So let me recap what this looks like, okay? Let me recap for just a moment. If somebody has an uncompensated ABG, the pH is abnormal. One or the other, the CO2 or the bicarb will be abnormal, not all three. pH plus 1. That is uncompensated. The sidekick is being lazy, okay? Now, if all three are abnormal, that is when we say partially compensated. What that indicates is the troublemaker. It pulled the pH outside the normal range, and the sidekick said, oh no, I'm going to start pulling back. It's like playing tug of war, okay? The sidekick says, I'm going to play this game too, and I'm going to start pulling. Now, it hasn't yet gotten the pH back to normal range. That's why it's partial. As soon as that pH hits normal range, between 7.35 and 7.45, that's when we can say that it is fully compensated. Now, hold on a second. What if all three are normal? Then what do we do? What do we do when all three are normal? It's just normal. It's just normal. Now, I do want to let you guys know that Archer Review, we are here for you all across the lifespan. From the day you're trying to get into nursing school with pre-nursing all the way through advanced practice. So no matter where you're at on this journey, know that Archer Review, we're here to support you, encourage you. We are here for you. We want to see you all reach your goals, whatever that may be. It probably looks a little different for each and every one of you. But I hope you enjoyed the live today. If you're in nursing school, hang out for just a minute. I do want to show you something. If you go to Archer Review and you go to our nursing school package, something that you can do if you're still in nursing school, which is really cool, is you can, instead of buying like the whole thing, let's say you're part of the way through and you're like, oh, I really want one course, or I really want just one course, you are able to get just that one course. So pharm, for example, pharmacology can be really, really tricky. So if you're like, ooh, I would benefit a lot from a pharm course, you can go ahead and you are able to customize your bundles and get whatever courses you want. Each course is just $15. So that way you can get that additional help if you need it. Thank you all for joining. I hope you have a great day. Good luck to you in your nursing journey. Bye, everyone.